Tonight, we're turning our attention to a big issue you may not be aware of. It has to do with transparency, accountability, and trust for the people making decisions on what's best for the health of our communities and our loved ones. Well, it's no secret that nursing and long-term care homes are the hotspots for COVID-19 in southwestern Pennsylvania. Now there are new concerns over whether nursing home residents are being marginalized in the state's fight. 11 Investigates has been digging into the treatment of nursing home residents in this COVID-19 crisis for weeks now. And what we're finding is no consistent policy from facility to facility, family members upset, a nursing home owner frustrated, and a U.S. Senator calling for more transparency. Here's 11 Investigates' Angie Moreski.
For weeks, Brighton Rehab in Beaver County was at the center of an ever-growing number of COVID-19 cases and deaths. Then suddenly, public updates on the number of infected and number of deaths stopped.
It feels like they're withholding information.
Family members like Matthew Sievers, whose mom is a resident at Brighton, were outraged when the facility released this cryptic statement saying, in consultation with the state, it decided to stop counting test results and presume all staff and residents may be positive.
I think it's ridiculous. And I think that they need to be open about what's going on.
As 11 Investigates reported first earlier this month, state inspection records show a serious history of safety violations at the facility. And now Sievers says it's even harder to get information about their loved one.
That's my mother up there. There should be no secrets.
About 10 days after Brighton's announcement, Kane Community Living Center in Glen Hazel also announced it would stop testing and assume everyone is positive after a major outbreak there.
I don't know why you wouldn't have more testing within a nursing home. That doesn't make sense to me.
U.S. Senator Bob Casey found the decisions to stop testing baffling. He's calling for transparency and sent this letter calling on the Trump administration to release a list of nursing homes with positive COVID cases.
It's absolutely essential, not only to making sure that we're monitoring the care they receive, the individual resident, and making sure that their families have an assurance of the state of their health, but it's also vital for the entire community.
He says it's a matter of public safety.
Because you have workers that are coming in and out of that facility, it's really a community concern, not just a concern of that facility and the families and the loved ones who are there.
James Cox is owner of Paramount Senior Living.
It is very irresponsible in my mind not to test.
He says if you assume all residents are positive, the shortage of personal protective equipment makes it unrealistic to protect everyone.
I'm just not sure how you would manage that. Everyone at all times would have to have full protective gear on, masks, goggles, gowns.
Since Brighton said the facility made its decision in consultation with the Department of Health, I submitted a question to the state health secretary on April 7th about that guidance.
So I'm not going to discuss a specific facility for privacy and confidentiality purposes.
Dr. Rachel Levine would not directly answer the question at her daily briefing, but said at the time PPE was not a problem.
It's a constant balance, but to date we have sufficient supplies.
Coffee filter.
That answer is in direct conflict with the experience of Paramount's owner. His facility has continuously struggled to get PPE, at one point even making its own masks out of coffee filters. Cox says he called the Department of Health for help.
We were told that we would be put on a list and that they would call us whenever they would have those supplies.
Cox got surprising insight into why the state is telling some nursing homes to stop testing when his own central Pennsylvania facility developed 5 positive cases.
The comment that was made was that let's not waste supplies.
At the same time, the state is telling some nursing homes to reduce testing. It's opening more public testing sites.
This week set up a mass testing site in the Northeast, which started actually yesterday.
It makes it seem like anybody now can get tested for this. Why can't my mother be tested for this when she has key signs?
Dan Veet is frustrated. His 93-year-old mom can't get tested. Teresa Veet is a resident at UPMC Cranberry Place and was denied a test, even though she has multiple risk factors.
It's really an unfair situation. I just feel like seniors are being discriminated against.
Is there any consistency between nursing homes
in regards to who is tested?
No, there's really not.
We certainly have prioritized the vulnerable population.
But despite public comments like that, some families say actions speak louder than words.
They really need to tediously take the time to test everybody and care for them like the human lives that they are.
I have asked questions every day this week about the PPE issue and concerns that family members feel their loved ones are being written off. Dr. Levine has not answered one publicly this week. Instead, we get written answers from a PR person sidestepping the questions, but I will keep asking. Lisa?
Angie, great reporting here, but when it comes to transparency, part of the problem seems to be just the way those daily health department briefings are set up.
Well, you know, that's true. Right now, there is no free exchange of questions and answers. The news conferences are very controlled. Reporters have to submit written questions in advance. The state gets to pick and choose which ones to answer, and there's no real-time follow-ups to get accountability. Now, I have asked for an interview with Dr. Levine every day this week. So far, they've said not at this time. It is a shame because this is such an important issue for the residents, their families, the workers, and the public. I will continue to press the state for answers. And you can see more on our investigation on our app and our website, including my full interview with Senator Casey. Angie Moreski, 11 Investigates.